Anne-Marie Casey. How are you today?
Good. How are you?
I'm really, really well. So, tell me who you are and what it is you do here at Redemption Psychiatry.
So, like you said, my name's Anne Marie, and I am a psychiatric nurse practitioner that has a subspecialty in perinatal mood and anxiety disorders.
Okay, and that's like postpartum?
Yeah. So, um, the general public knows postpartum as being a negative thing.
Hmm.
Postpartum just means after birth.
Right,
But postpartum depression is referenced as postpartum
right.
by lay people. Yeah.
Is there a difference between like postpartum depression and postpartum anxiety?
Oh, yeah.
Okay, what is the difference?
So, depression would be a sad state, a lack of joy state,
Right.
with, of course, other symptomology.
Hmm.
Anxiety is more of chronic worry, nonspecific fear, with also other symptoms of anxiety, too.
And do they usually go like hand in hand, or does one usually kind of lead the other?
Usually, one will start first. And if it's not treated or undertreated, you'll usually see the other one come along.
Hmm.
Yeah.
So how'd you get into this specialty?
Hmm, Fun. Okay, so that's a really far back question
Okay.
because normally I've said, yeah, it started when I was bored working in postpartum and started to research it. But actually, it was really years before that
Mm.
when I was a community health nurse in New York.
Mm.
Mhm.
Wow.
And I would get to go to house to visit mostly the elderly, mostly Medicare patients.
Hmm.
And you would develop these intimate relationships where you would almost become a friend. And when I moved out to Arizona and I had to um, go into the acute care setting, meaning a hospital, for work, I said, I really want to try to work in postpartum. And it was reflective on my home care, my visiting nurse care years, where an 80 or 90-year-old woman would recall her birth stories to me like it happened, a year ago.
Whoa.
And I really wanted to impact that because it's such a powerful memory,
Right.
for a woman or for a family. And I wanted to impact that positively because I tend to be a bit of a Pollyanna.
Hmm.
And I've always, even being as long as I am a nurse today, I'm pretty jazzed about it. It's a field that I really like.
That's really cool.
Yeah.
What made you come out here from the East Coast?
Just the opportunity of having an easier life.
Mm.
It's a lot less expensive than New York, and
Yeah.
you
Yeah.
don't have to buy all that winter gear, especially raising
Yeah.
little ones.
Yeah, I really enjoy not brushing 6 feet of snow off my car now.
Yeah.
It's fantastic.
Yeah.
Um, so I kind of want to go into some of, I think, like the more common questions that
Mhm.
a mom who is trying to get pregnant or who is expecting might have. So, first off, is postpartum depression like what's the difference between that and like the baby blues?
So, what we know as of the baby blues, that is after you deliver the baby, with the delivery of that placenta, you can have a pretty quick onset of a hormonal change where
Hmm.
you may have every single emotion you've ever felt in a lifetime all in a 10-minute span.
Wow.
Yeah. So, and if you just think about the whole birth process,
Right.
it's a pretty intense journey,
Yeah.
right? So, you can experience all those emotions, but it shouldn't be severe.
Hmm.
It shouldn't be lasting.
Right.
It shouldn't be impairing your sleep outside of the baby waking you.
Hmm.
And it definitely should not exceed that 2-week period.
Right. And so at that point, is that when it starts becoming postpartum?
It could, depending on, the assessment that's done to see, what's going on. Like, is there, is that woman meeting criteria for depression? Is she meeting criteria for anxiety? Is she meeting it for both? Does this look more like it could possibly be a mood disorder where perhaps there's some vacillating symptomology where she could have some hypomania or mania that is,
Can you describe those two?
yeah, so hypomania would be lesser than mania.
Mhm.
So it's a lesser degree of mania. And mania, mania and hypomania has to last longer than 4 days
Mhm.
to
To be
to
classified?
yeah, to be
Right.
diagnosed or to further probe, what's going on. But mania would be like being overly stimulated, having way too much energy, way too much impulsivity that's out of character, not sleeping,
Mhm.
hypersexuality, maybe shopping excessively on Amazon and spending hundreds or thousands of dollars impulsively. Yeah, yeah.
So, what's the difference? Because I've heard people be like, "Oh, like, I'm in a manic episode right now," and I'm
Hmm.
like, "Why?" And they're like, "Well, I went and bought painting supplies and painted."
Hmm.
Okay, so what's the line between like you're just spontaneous versus like you're actually dealing with a manic
Right.
episode?
It's where it's impairing your life and maybe
Mm,
even cognitive impairment where you just are lacking insight and maybe the people that are around you and love you are trying to bring it to your attention.
hmm.
Yeah.
Wow. How much is when it comes to postpartum depression and anxiety? How much of that is hormonal? Like, is
Well,
that the main cause?
so we don't know exactly the main cause, but
Hmm.
yeah, there's some hypothesis that it's that sudden hormonal shift and
Mm-hmm.
its effects on brain chemistries.
Hmm.
Mhm.
And can that happen like before the actual pregnancy? Can that happen in the prenatal stage?
Sure, it can.
Okay. And then what? So if you're prenatal and you're wondering, like, how do you know, actually, in both prenatal or post, how do you know when it's time to go see someone?
So it's always important that you advocate for yourself or listen closely to your loved ones that you trust and support you
Mm-hmm.
um, to get help maybe sooner than later. So if your symptomology is impeding your life negatively,
Mm-hmm.
where you're not caring for yourself, you're not caring for the baby, you're not feeling rested, um, if you have any negative thoughts such as suicide or homicide, um, that's all emergent where you would just, you know, go to your local hospital, your
Right.
local ER to get help.
Right.
Yeah,
So what about, how about, sorry.
sorry.
If you're a mom and you're obviously making a child, how does that affect medications? Because I think that's a big concern is like, well, what if the medications that the doctor puts me on affect the baby?
Right, right, right. So, um, most psychotropics are the one medication that have been studied extensively from, you know, retroactive, like
Mm-hmm.
retrospective work. Like, for example, the British Medical Journal did a retrospective study on, I think, 30,000 women that took antidepressants during their pregnancy.
Mm-hmm.
And they couldn't correlate a problem or see a problem with any of the antidepressants that were used. And antidepressants, what we know of antidepressants, such as SSRIs
Mm-hmm.
or SNRIs, they are too the first line of defense for anxiety, also. And a lot of persons don't know that.
And what's the difference between an SSRI and
So the difference between an SSRI and an SNRI is the N.
okay.
It stands for norepinephrine.
Okay.
Yeah.
Interesting. And then what about like if the mom already has battled with depression, anxiety, PTSD, is that like a risk factor?
Sure, sure, absolutely.
And how does it affect it once it hits?
It can exacerbate the situation to a much more intense experience with depression and anxiety and trauma.
Mm-hmm. What
Mhm.
about like ADHD?
ADHD?
Uh-huh.
Yeah, that's interesting. So, untreated or undertreated ADHD,
Mm-hmm.
um, it can create a depressive state or an anxious state in someone just because
Mm,
it's not being treated. It makes
right.
sense, like attention deficit disorder.
Mm-hmm.
And especially when you are looking at moms, like caring for this new baby. Maybe it's the
Right.
second, third, sixth baby, household has to go back to work. It's a lot of balls up in the air.
Mm-hmm.
So, a lot of women who deliver don't even realize that they do have ADHD.
Right.
And we find it out in the postpartum period because it's just way too much on their plate, where perhaps in the past, like going to college or high school, they did fairly well,
Mm-hmm.
but they were able to create coping skills to
To battle.
battle the
Right.
inattention and the impulsivity. And now, when you just load them up with all this responsibility,
Yeah. They're like,
yeah,
ah.
yeah.
So ADHD is definitely a disorder that is stereotyped as like a young boy's disorder, right?
Hmm.
It's the young kid bouncing off the walls,
Right.
ADHD. So what does it is it different for like a mom? Like how does it present differently? Is it harder to notice?
Well, for like an observation,
Mhm.
um, you probably are going to have somebody that's a little bit more restrained, unlike a little boy who
Mhm.
has loads of
Right.
hyperactivity,
Right.
right? So that would be the difference. But, we do have moms that have ADHD. They
Mhm.
definitely have the hyperactivity when we run a specific diagnostic test here
Mhm.
that's all objective data, and you can see that they are hyperactive.
Right.
Yeah.
Interesting.
Mhm.
So how did you end up at Redemption Psychiatry?
I had my own little practice right down the street.
Ah, okay.
Yeah.
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 And then just
It's just way too much for one person.
yeah,
Yeah.
interesting.
Yeah.
And how long have you been here?
7 years.
Wow.
Yeah.
Yeah, that's pretty awesome.
Hmm.
Um, what are some of the like more interesting cases that you've dealt with?
I guess the success ones.
Really?
Yeah. Yeah.
Yeah.
It's very rewarding.
Hmm.
Yeah.
That's really cool. Do you
Yeah.
have any like specific ones in mind?
Um, Not that I can
Obviously,
really
you can't
recall,
say
right?
names,
Yeah,
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 which
yeah.
makes it tricky.
Yeah, it really
Hmm.
does. Yeah.
Interesting.
Yeah, I mean, it's just taking care of a large population of young moms.
Right.
And, you know, you're not just helping the mom
Mm-hmm.
in this type of mental health care. You're helping the entire family. And
Right.
that's just so motivating. That's so rewarding.
Wow. So then going back to that, how well, let's start here. When it comes to dads, like who are concerned with the wife, right? Let's say the wife gets the diagnosis.
Hmm.
What would you say to a dad who um, just had his wife come home and tell him that? Like, what can he do to better help the situation and like get more educated on the issue?
Yeah, yeah. I would refer a dad to postpartumsupportinternational.org, which
Mm-hmm.
is abbreviated PSI.org.
Mm-hmm.
And they have great education on there. They also even have dad support groups
Mm.
because a dad has a 50% increase chance of getting postpartum depression if his um, partner is depressed or has diagnosed with PPD, postpartum depression. So
Right.
that's one thing. The big thing that I think is so helpful for dads is to allow that mom to replenish and get some really good sleep. Because when
Right.
we think about that last trimester, there's
Mm-hmm.
such a deficit in sleep with repositioning and getting up to use the bathroom.
Mm-hmm.
And then to go through a a labor and then delivery and then have a newborn, she really comes in at a sleep deficit.
Right.
So if you could get like sleep share and at least allow each of you to get 5 hours of uninterrupted sleep, I think that has real benefit. Now, is it realistic? And are people out there like throwing things at this podcast? Yeah. But if there's any way that it could be accomplished, and I work with my parents to try to assist them in problem solving that,
Mhm.
so because it is that crucial.
Hmm. Interesting. What are some of the other things that you do outside of just prescribing medication to help couples battle through this?
Support groups.
Hmm.
I actually started the first support group
Mhm.
here in the Phoenix metropolitan area.
Oh, wow.
Yeah, eons ago.
Wow.
Yeah.
I didn't even know that.
So um, it was at um, it was at Chandler Regional Hospital,
Mhm.
which really helped me facilitate this journey in my profession. And the support group is still going on today,
Mhm.
and it meets every Wednesday. And I think that that can be really helpful. I think psychotherapy with a therapist or a psychologist that is an expert in this area is
Mm.
really helpful. And
When should someone seek out therapy versus medication management?
so it's really good that you do them in tandem
Mhm.
because if you have a mental health issue, like I tell my patients, it's here, right? It's
Mhm.
right here. And like we're able to move that level of wellness a lot quicker when we come at it with psychotropics from one end and psychotherapy from the other end.
Right.
So that's optimum. Do a lot of people want to avoid one or the other? Yeah, they do. Will we
Right.
try to meet them where they're at? Yes, we will. Yeah.
Right. Wow. That's really interesting. Um so I guess I'm just what does a session look like with you? Like starting with intake, the first day, like someone they pop into the video.
Hmm.
You're a telehealth provider primarily,
Yeah.
right?
Yeah.
Can you talk to me about that first? About being a telehealth provider?
Yeah. So, um, I usually in the past, pre COVID,
Mm-hmm.
seen patients strictly in the office,
Right.
right? But with COVID, of course, like most industries, we had whoever could go remote and work remote did work remote.
Right.
And now that we're somewhat um, healthier as far as a nation, uh, the thought of bringing my mom's back into the office for a
Mm-hmm.
traditional appointment is really hard for them since
Right.
they've spent 2 years doing telehealth,
Right.
where they can just honestly, most moms just go and lock themselves in the car so they could have a 20
Yeah.
minute
Break.
uninterrupted follow up with me.
Right.
Yeah.
Yeah, I will say like when I schedule patients for you, I'll always be like, "Hey, just so you know, like she's a telehealth provider, so it'd be over video. Would that be okay?" And every single time it's, "Oh, thank God." It's
I
like, "Ah,
bet.
interesting." Yeah.
Yeah.
So let's say that they do get an appointment with you. What does the first appointment look like? What do you go over? What
It's
do
a
you look
lengthy
for?
one. So
Mhm.
they have to fill out a lot of information:
Mhm.
family history, past meds, their current medical situation, past medical situation. And, um, and then it's a pretty in depth discussion that lasts usually an hour.
Yeah.
Yeah.
Wow.
Yeah. And it's just, the more information that I can get from that particular patient, the more informed decision making I can do.
Mm. Mm. And then after that, um where do you guys go from there?
Then usually for safety and for just comfort of
Uh-huh.
my mom's depending on the assessment, but more likely I will follow up if this is their first time starting on a medication.
Mhm.
I will follow them up in 2 weeks
Right.
just to see where they're at. how it's going, if there's any side effects, if there was an adverse effect. And we do
Mm,
have nurses here that I give them all that information during their intake or follow ups where they can call the nurse if there is an adverse reaction and
yeah,
discuss it with the nurse, and then she'll staff it with me.
right.
Hmm.
What's your favorite part about doing what you do? Sorry, that was a very quick like change of subject,
Yeah, yeah,
but
yeah,
that's just
yeah.
what popped into my head.
I guess is what I discussed before. Like you're
Yeah,
just impacting a whole little family,
right.
which is kind of cool. When you're practicing psychiatry, there's those that will do children and they love doing children.
Right.
And there's those that do adults and they don't want to do children, they want to do adults. But really, I'm doing both.
Right.
Yeah.
Yeah. Do you
Yeah.
ever see yourself shifting at all?
To children?
Yeah, or to anything else?
I'm not sure.
Really?
Yeah, I'm not sure.
Hmm. It's where the future takes you, I guess.
Exactly.
Interesting.
I would love to mentor or supervise um, other psychiatric nurse practitioners that have a passion for maternal mental health, such as I.
Mm-hmm.
I'd really like to promote that and to promote the ongoing
Is
education that I've pursued. Like I usually do something at least yearly.
right.
Yeah, some
Is
conference.
is that something that's needed? Is more people in your
Absolutely.
specialty?
Yeah, yeah.
Really?
Like Baskin Robbins, they have 32 flavors.
Uh-huh.
Yeah,
Yeah.
there should be more nurse practitioners to choose from.
Right.
Hmm.
Interesting.
Or psychiatrists.
Right.
Mhm.
Right. Right. What is something that like if you could change it, you would, or something that might be frustrating about patients, or maybe like a preconceived notion you wish you could change in patients that, or in people generally about postpartum depression?
Yeah, the misconception is that it will get better without help,
Mm,
and that people think that they have to white knuckle through this,
right.
and it's not the time to white knuckle.
Yeah.
Yeah,
Do you see that a lot? Do you see sort of like an aversion to getting help?
yeah, I do.
Really?
I do.
Hmm.
Yeah.
And how do you interact with that?
I just am a great listener, and that's why I just do such
Yeah.
a lengthy intake. Yeah,
Right. So you
yeah,
can.
yeah,
Interesting.
yeah. And I think when you really listen, that it really starts that whole trust relationship with your provider. That's so helpful.
Hmm.
Yeah.
Can dads get postpartum depression?
Mm-hmm.
And what does that look like?
Just sadness, lack of joy,
Really?
laying around on the couch, not getting up,
Mm.
just apathetic.
Mm.
Mm-hmm.
And what do you recommend to them?
Oh, dads, I really recommend for them to reach out and get help. I mean, I am more than happy to see dads,
Right.
more than happy. And so are the psychotherapists that I work with. A lot of them have dads groups, or they'll have a male if dad prefers a male. But believe it or not, a lot of dads prefer female
Right.
therapists, so that's good. But yeah, it's to get the help. Like this is an important time in your life. It doesn't have to be that hard.
Hmm.
Surround yourself with the support that you need. And it's always a decision making thing. Like, sit down, do an intake either with the psychotherapist or the
Hmm.
psychiatric provider,
Hmm.
and then make your decision. But at
Right.
least you get the knowledge
Yeah.
and
At
the
least go.
information. Yeah,
Yeah. You can go figure it
yeah,
out.
yeah.
Interesting. Um, would you say that um, it can happen where a mom maybe like has a child or two children and it goes really well, and then like the third or fourth, it's like, oh, right, like
Yeah.
is that does that happen a lot, or is it usually like the first pregnancy that this happens?
No. I've had
Really?
somebody that had 6 children and, like,
Wow.
just would tell me that it happened with the 2nd, 3rd, and 4th.
Wow.
Yeah, it just depends.
Uh-huh.
But then, a predisposing factor is if there's any birth trauma.
Right.
If there's any birth trauma or labor trauma, then of course that's,
Hmm.
increasing that chance
Mm.
of experiencing a mental health issue.
Mm. What are some of the other risk factors then that might?
Hmm. Yeah, so a past history of anxiety, depression, or mood
Mm-hmm.
disorder, or a past history of PTSD,
Mm,
post traumatic stress disorder. I can't emphasize that enough. That if you've had a trauma that was significant to you,
mm-hmm.
that it would be best to engage in mental health services if you are going to have a baby,
Mm,
to kind of be proactive.
mm-hmm.
Um, I forget where we were going now.
That's okay.
Okay. Oh, the
Um,
risk factors.
right. Yeah,
Yeah.
yeah,
So a baby in the NICU, the neonatal intensive care unit,
yeah. Mm-hmm. That's a big one.
infertility,
Yeah.
yeah, marital discourse.
Mm,
How about this one? How about finances?
really?
Hmm.
Yeah.
Right? How about lack of support? Like that was very prevalent during COVID.
Would
Like,
you say those are like the most common?
hmm,
Wow.
yeah.
Hmm. So what would you say then to people who have like those two issues specifically, where they might feel isolated and be averse to reaching out,
Hmm.
or might be like really financially concerned about it?
Right, right, right.
Mm-hmm.
Yeah, like here at Redemption, we do create payment plans.
Mm-hmm.
We do a lot of pro bono work.
Yeah.
Um, there's one organization that is a plethora of therapists that specialize in perinatal mood and anxiety disorders and are all trauma trained, and they take
Mm,
access.
yeah.
Yeah, and which is Arizona's Medicaid program.
Right.
And the support groups are all free. Postpartum Support International.org, PSI. They have free resources on there.
Mm-hmm.
Mhm.
What are some other? So you talked about like seeing a provider, a psychiatrist, a therapist before or early on. What are some other sort of proactive things that can be done early on, right? When you're trying to get pregnant or when you're just pregnant to help reduce the chances of having really bad postpartum depression or anxiety or anything else right after pregnancy.
Yeah, yeah. I think it's, that proactive stance, contacting your OB, having a sit
Hmm.
down to discuss before you even get pregnant if possible,
Right.
you know. Um, I think that if you're fearful or you have a past history like we discussed, then I think it's really a benefit to that family to at least come in and sit down with a mental health expert
Hmm.
that specializes in reproductive health.
Right. Hmm. That's interesting. What are so you mentioned PSI?
Hmm.
What are like the other resources that you would really recommend that are really good for someone who's just looking to get more information on this topic, whether they be the husband, the mom, or just like a friend or family member?
Right, right. The support groups, there's
Mm-hmm.
support groups now all over the valley. I think they're at the two banners like Banner Gateway,
Right.
Banner Desert, maybe even, I know that I used to do a NICU group for post traumatic stress disorder for new parents in at Banner University in Phoenix and in St. Joe's.
Mm-hmm.
So the hospitals do have resources and you can reach out to them.
Hmm.
Hmm.
Wow. And then how does this affect like the marriage, right? Or the relationship?
Yeah, yeah. So, yeah, it can definitely affect the relationship. I've heard it, a number of ways. Like if that mom doesn't get help, then you get a husband or a partner that can get really bitter and resentful that she never got help.
Right.
That's pretty common. Or else, like if that mom doesn't reduce her anxiety or treat her depression, the irritability portion for both depression and anxiety is pretty high.
Mm-hmm.
Even being agitated, anger, rage, and that has a detrimental
Right.
effect on relationships.
Yeah. Obviously, that makes it harder for both parties to be all
Yeah,
lovey-dovey all the time.
right. Or
Right.
just to communicate effectively.
Would you say that like is it sort of blinding to partners sometimes to like go through the pregnancy and then see this really big shift in mom that maybe they weren't aware of.
Yeah. Yeah, sometimes it's really obvious like
Hmm.
that, and yeah, it's quite concerning for dads. And then, how do you broach the subject?
Right.
And then if she's irritable and agitated,
Yeah.
it's a very fine line to
Right.
walk.
To be like,
So,
yeah,
yeah.
especially to be, oh, you need to go get help, right?
Yeah.
Like that's a really
Yeah.
tough
Yeah.
conversation to
Yeah.
have.
So I think if you come from, uh, with the I words, I'm
Hmm.
concerned,
Right.
you know, I love you. Like, I think you
Right.
can feel better.
Hmm.
That's a really good avenue to go down.
Hmm. So it goes back to communication,
Yeah, delicate communication.
right?
Yeah.
In a delicate
Like, you
time.
don't need to feel this way. You
Hmm.
can get help.
Hmm. Um, so then what are uh some of the other symptoms that you might look out for? Especially like intrusive thoughts. Is that
Hmm.
um when is that kind of like okay and normal versus of like you need to go talk to someone versus like you should just go like to the ER, right? Like
Yeah.
where are the lines in that spectrum?
So that's postpartum psychosis
Mm-hmm.
versus OCD.
Okay.
And if I could explain that.
Yeah,
So,
please.
postpartum psychosis is an emergency. That's
Mm-hmm.
an emergent situation that you act on immediately by just going to the local emergency room
Mm-hmm.
or local psychiatric hospital.
Right.
And that's if somebody is hearing voices or seeing visions that other people don't see or hear,
Mm-hmm.
or if they have a belief system that or a belief that has come out of nowhere that's not making sense to more
Right.
than one other
Like just
person.
immediately becoming
Yeah,
very spiritual and just talking about things off the cuff,
exactly.
right?
Yeah, yeah. Hyper religiosity
Mm-hmm.
is problematic. Paranoia is problematic. They're considered a possible psychotic state. And you would just go to the local emergency room to get help.
Right. What's the difference between the like hyper spiritualism religiosity that you're looking for versus just like being religious, right?
Yeah, it's just that change,
Right.
you
It's that
know?
shift from
Yeah,
pre.
yeah, yeah.
Interesting. Hmm.
Mhm.
Is that common?
No, it's rare. It only
Okay.
happens in 1 to 2 delivered moms, I think, out of 1,000.
Hmm.
Yeah.
So then if you're a mom, I mean, you're hearing about on top of all of the other things you're concerned about, right? It's like, well, there might be postpartum depression and anxiety and
Mhm.
psychosis and OCD and ADHD. What are the things that a mom should be like, okay, like this is maybe more likely something I should take in consideration and work to at least be prepared for versus these are things that are more just fear mongered, right? Maybe things that I don't need to worry about if I'm not like actively doing really poorly,
Mhm.
right? Does that kind of was that like a
No.
okay, let me go into more detail.
Okay.
So like you said that the psychosis is really uncommon,
Mhm.
at least relatively. How common are like uh postpartum depression and anxiety?
So you can have I think this is what you're asking.
Hmm.
You can have depression that becomes severe, that you can have a, a psychotic break with it or
Mm.
have psychosis with it, right?
Hmm.
But postpartum psychosis, it usually occurs like within the first 2 weeks of delivery.
Okay.
And the person really sounds in their communication and maybe even in their actions sounds very far removed from the person they were previously.
Mm.
They're detached from reality.
Hmm.
And it's a pretty quick onset. Usually, if it does occur, it'll occur the first 2 weeks post delivery.
Right. And then how long could it last?
That takes an inpatient stay to get stabilized,
Mm.
usually on medication. Yeah,
Hmm.
yeah.
And then what about just like normal postpartum depression and anxiety?
S-
First off, when do they normally take effect?
When the
When
what?
do they normally take effect? Is it like right after?
Well, you can have the baby blues for the first 2 weeks,
Hmm.
but even before that, even within that first 2 weeks, if it's severe, Like, is it really baby blues, or is it
Right.
something that you should really call and have an evaluation done?
Mm,
I mean, it doesn't hurt to be evaluated. It
right.
doesn't.
Right.
Yeah.
Um,
And you gain a wealth of knowledge during
right.
the appointments.
Yeah, I've learned a lot in the last
Yeah. Yeah.
however long we've been talking. Um, how long does it normally last, postpartum depression or anxiety?
So it can last. I mean, it can it can last, and it can also get undertreated.
Mm-hmm.
I think that it really takes a mental health professional to treat it properly in a lot of cases. But, maybe I'm a little biased on that.
Right.
Maybe there's great success stories, where OBGYNs, which is obstetricians, are treating it and
Right.
have great success. Um, but usually I'll get patients that, have been put on some type of agent prior by their OB.
Mm-hmm.
Um, and that can be sometimes helpful or sometimes harmful.
Right.
Hmm.
Hence why you exist and why people should
Yeah,
talk to you.
yeah,
Yeah.
yeah.
Would you say that um that's where you get a lot of your patients is OBGs referring out to you?
Hmm. Yes,
Yeah.
yes. And just word of mouth.
Yeah, I've
Yeah,
noticed that as well.
yeah,
Yeah, I get a lot of calls and it's like, "Hey, like so and so sees Emery. Can I see her?" And I'm
yeah,
like, "Yeah, yeah."
yeah. And I'm not a social media person, but
Mm-hmm.
I hear that there's some social media references.
Ah, there you
Yeah,
go.
yeah,
Yeah, that's pretty cool.
yeah.
So, kind of pulling away from that, what's a normal day in your life look like?
A normal day for me,
Yeah.
like as far as professionally or personally.
Whichever one you're willing to talk about.
Oh. Well, yeah, I live in Gilbert,
Mm-hmm.
and I love my dogs and
How many
family.
dogs do you have?
I have two,
Mm-hmm.
and I have one son that still lives in Gilbert,
Mm-hmm.
and two other adult children that
Mm-hmm.
live out of state.
He works here,
And
doesn't he?
yeah, he
Yeah.
does. He does. He does.
Yeah.
And I love to travel,
Mm.
and I love working,
Mm-hmm.
and I started golf lessons and, and working on a
Interesting.
pottery wheel.
Oh, wow.
Yeah, yeah,
Wow, you're full of surprises.
yeah.
Oh, all right. Is there anything else that you want to cover?
Yeah. So I just wanted to tell you or talk to you about OCD.
Oh, yeah, let's get into
Yeah.
it.
So why I talk about psychosis and OCD is because that's the most common question that I get on new patients coming in.
Really?
Yeah. Because when they have postpartum OCD, they have intrusive, horrific thoughts.
Mm.
And those intrusive, horrific thoughts can sometimes lead them to believe that they're going crazy or psychotic.
Mm-hmm.
And the difference is really great to distinguish right now.
Mm-hmm.
I hope people get to see this is
Right.
that if it frightens you and you're like chronically worrying about your thoughts, means that you have an awareness
Right.
to those thoughts, whereas somebody that is psychotic isn't aware,
Mm.
right?
They're like, yeah, it's fine.
Yeah.
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 Interesting.
So it creates hypervigilance
Mm-hmm.
and difficulty
And this is the most
sleeping.
common thing people bring to you.
It really is. Like the
Wow.
stats on it are fairly low,
Uh-huh.
but clinically, I probably see it a lot more than what the stats are telling us.
Interesting.
Yeah.
Wow. And so what do you do about that?
It can be treated successfully with medications and some psychotherapy.
Wow. So we talked earlier about the need for both therapy as well as medication management. How do those two things play together? Like why is it so important to do both?
This is why, because if you get on medication, you can reduce your acute symptomology down, where you can engage in your therapy sessions more successfully. But if your anxiety is really high, or you're really sad and apathetic and low energy, low
Right.
motivation,
It's
how
hard
can
to
you really,
build.
yeah, how can you
Interesting.
engage? Yeah.
Mm-hmm.
So meds might not be forever,
Right.
but they'll just get you to a place where you can do the work to get well, and you will be well.
Interesting.
Yeah.
Yeah. What So let's say that we're doing therapy and the medication management.
Mhm,
Is there anything else besides like groups you talked about are super important, right?
mhm,
It's really important to have a really strong support system.
mhm.
Um, is there anything else? What about like diet, exercise?
Yeah,
Obviously, those things are really hard to do when you're taking care of a
right,
new living human being,
right.
but how do those play a role?
Sure, of
And
course they do.
sleeping.
Yeah, it's the sleep, it's good nutrition, it's
Hmm.
some exercise, it's some self care, it's some time to yourself, to recharge your batteries. So
Hmm.
crucial. Yeah,
Would you say that like sleep deprivation is the most common like physical or physiological symptom you see?
it can sometimes, yes,
Really?
definitely. Yeah.
Wow.
Hmm.
Hmm. Hmm. That's really interesting.
Yeah.
Is there any is there anything else that um you would want to tell a patient who or an individual who's considering becoming a patient?
Yeah, reach out, get
Yeah.
help. Yeah,
Yeah.
yeah.
Do
The,
you think there's a lot of negative stigma?
um, I think it's lessening,
Mhm.
but yeah, there is. There
Mhm.
is,
Mhm.
But I think with telehealth, that it's a lot easier to approach.
Right.
Hmm.
Yeah. A video call is a lot easier than going to the office
Oh,
and the big
yes.
scary.
Ooh,
Yeah.
yeah,
Yeah.
yeah,
Interesting.
yeah.
Um
And like I said, it's, you know, we have a term in psychiatry.
mhm.
We'll set the table. You don't have to take the mashed potatoes if you don't want to.
Right.
you know,
Right. Yeah.
and there's no offense in there. So many patients get so worried if they stop meds or taper meds independently outside of what their provider is recommending. And yeah, you shouldn't do that.
Right.
Let us know.
Yeah.
But I mean, you're running your own show.
Right.
This
Yeah.
is your life.
Wow.
We'll give you our recommendations. We'll base it on evidence based research,
Mhm.
but it's all up to you.
Is there um a frame of mind that you try to promote in your patients, like that like self-efficacy of um kind of taking control of your own health versus um just kind of going with the wind?
Yeah, yeah. I'm a big advocate for a patient speaking up for themselves
Mm.
and, working collaboratively with me.
Mhm.
I very much promote that.
Wow.
Hmm.
Well, that's very interesting.
Hmm.
Mhm. Um I mean, that's is there anything else you want to talk about?
Not that I
That
could
was
think
my
of.
mind's like because I don't think, believe this or not, I don't think about pregnancy daily. So for me, this has just been like the wormhole of information.
Oh,
Um, but it's all so interesting. Um, what would you say to people like me who are, a young guy who this is just not a normal thing to think about, and uh, who like I honestly I knew postpartum depression was a thing
yeah.
until I started working here and working with you.
Hmm.
I literally just knew that it was a thing that existed kind of somewhere maybe.
Right.
So would you say that awareness is like an issue that needs to be addressed?
Oh, absolutely.
Hmm.
Absolutely. Yeah. Yeah.
And like,
Because the interesting thing about it
yeah.
is that we may pass this on generationally.
Mm-hmm.
Like a mother may tell her daughter, but what about those in between generations? So,
Right.
like, for example, Christy, I think it's Chrissy Teigen,
Mm-hmm.
right? You see her on the cover of People magazine. Like, why didn't somebody warn me?
Right.
Right?
Yeah.
So it's so funny that you'll see, some type of headline, some type of magazine cover every once in a while, but it's just because it's not well discussed. Like you get so busy with life raising children, and do you really want to hook on to, that a negative aspect instead of a positive aspect
Right.
when it's so hard and so um, brain draining to raise children?
Right.
Yeah.
Yeah. I'm putting that off for a few more
Yeah.
years
Yeah.
myself.
But you could go and hug your mom.
Yeah, I probably could do that. That's we all probably could go hug our moms.
Hmm.
That's a really good I don't think anyone can argue with that one. People are putting their rocks down. What about like postpartum generally? Is there still like a negative stigma, would you say, around that and around just like, oh, she's crazy, right?
Yeah, well, it's, bringing life into the world. Somebody told us it's supposed to be the happiest time of your life, and a
Right.
lot of us work really hard at achieving that.
Yeah.
So then when the little person comes into the world and things aren't going smooth, maybe like you just can't get that latch, or they're tongue tied or lip tied, or
Right.
oh my gosh, just can't get them to breastfeed, or you had, a very long, enduring labor, and then, pushed for an hour and ended up with a C-section. Like,
Yeah.
yeah, it's just,
Does that have an effect?
sure,
Yeah, like
sure.
C-section on
It can happen, yeah.
really? Wow.
Yeah.
Wow.
So, yeah,
Yeah.
it's a lot.
Yeah.
Yeah,
It
it's a
is.
lot.
Wow. Guess I'm gonna go hug my mom.
Yeah.
All right. Emery Casey, thank you so much for coming on.
You're welcome. My pleasure.
All right.
Bye.
Bye.